Greetings, loves. I am Tacticool Girlfriend. Welcome to the channel. Glad to have you back here. Today, I'm going to be talking about my IFAK, or the individual first aid kit. That is something that I believe that every person who handles a firearm should carry around with them if they are carrying a firearm around with them. We haven't talked about making holes, but let's talk about plugging holes. I believe that this skill is arguably more important than making holes in the first place. We should be able to save lives, not just be able to defend them. With that being said, as we review my kit that I specifically like to carry around with me, please keep in mind that I am not a medical professional and that this video is in absolutely no way an authoritative replacement for actual hands-on training. So please get training first and foremost. The idea of the individual first aid kit is to, first of all, design it around portability and convenience. You want to make sure that this is on you whenever you are carrying your firearm. That means making sure it is designed around the mission that you are using it for. If it's an EDC kit, it might be something very bare bones, and that is okay. It needs to be easy to carry. If you are carrying a heavier tactical load, you may have something on your belt line or on your backpack, what have you, whatever it takes, make sure that you have this on you. The IFAK is specifically designed around stopping massive hemorrhaging, as well as various other injuries that may occur due to gunshot wounds. So please make sure that you take this seriously as you continue using your firearm. One thing to note, you want to make sure that you are only carrying what you are absolutely comfortable carrying and able to use proficiently under very extreme stress. This means not stuffing random objects that you bought online once upon a time and forgot about into your kit, only to just try to employ them in an emergency situation. You are trying to do less harm, not more. Do no harm. Make sure that you are proficient with every single item in your kit. Now, what does my IFAK look like? The IFAK that I like to keep on my main tactical kit is a rather large one. Some may be smaller, depending on your needs. Again, I like to over-prepare a little bit here, but your mileage may vary. Every IFAK is going to be different. Every IFAK is going to be built around a different purpose and proficiency. So please bear that in mind that this is entirely subjective and just mine. As for my IFAK, I like to use the Condor rip-away EMT pouch. This thing has Velcro on the back. I like to mount this on the very back of my backpack to a MOLLE panel with Velcro on it, and has this nice handle that hangs down so I can grab it with either one of my hands if I need to, in case the other one is out of commission. It is very, very vital that your IFAK is going to be accessible, easy to grab, and easy to reach. So please keep that in mind when you're designing this. As for my Condor rip-away EMT pouch, there are some fancier ones out there, but I just like this one because it was affordable and has some really nice storage solutions. As you can see here, 3 different sections for various needs. Diving into this, let's do that. So the first thing in the kit are gloves. You want to have some sort of nitrile or latex-free gloves, such as these. I usually like to roll them up in a ball and just stuff them in there wherever is convenient. And you want to have these because you are trying to mitigate the spread of contaminant materials and biohazards. So that means not spreading anything onto you as well as onto whatever wound you're trying to treat, whether it's you or somebody else. The next item are trauma shears. You do not want to have to just remove somebody's clothing or your own when they're bleeding out in a very, very hectic situation. You need to get to that wound as fast as possible. If it is obstructed by clothing, you need to quickly remove it, and these are the best way to do that. Next thing to note are alcohol wipes. These are very important for cleaning up a wound site so as to prevent infection as well as to better see what the wound looks like so you can better treat it. The next thing that we got is a tourniquet. Tourniquets are very, very important for stopping massive hemorrhaging wounds that cannot be stopped by pressure alone on limbs. You do not wrap this anywhere else around you, not on your torso, not on your neck. I mean, in the bedroom, but tourniquets are applied between the wound and the heart, tightened down with a windlass. This one right here is a cat tourniquet. I personally really recommend these because they are very easy to apply not only to somebody else, but also to yourself. That is very important, so please keep that in mind that that may be an issue. The other one that I really like to use are the soft T wide tourniquets. These are another very popular choice. The main reason I do like these is because they do fold up to be very compact. I do find that they are harder to apply to yourself, but these are very good for EDC, especially if you're trying to save space. Another thing to note, please buy all of your medical supplies from a reputable manufacturer and seller. Some of these cat tourniquets have copies floating around there on the internet, especially on Amazon, which are completely not up to spec. The plastic windlass on these can break if they're not made very well. The cat tourniquets do a very good job and are very proven to not do so. I highly recommend going to North American Rescue as your primary source for most of your IFAK needs. Next up, we have a Sharpie. Yes, believe it or not, this is the next thing on my list because you need to write the time that you applied that tourniquet to either yourself or somebody else so that a first responder can reference it when you're taken to a hospital and have that information to go off of as they deal with further treatment of your injuries. Next up, you want to have some sort of hemostatic agent or gauze. I'm using the Celox Rapid Z-Fold gauze. This stuff is really good for stuffing into a wound that is very wide and is bleeding out quickly and cannot be treated with a tourniquet or pressure alone. Next up are chest seals. Chest seals are an absolutely essential part of your IFAK. These are used to occlude any sort of puncture in the chest or thoracic cavity. This is used to prevent tension pneumothorax, the collapse of a lung due to uneven pressure. You want to make sure you have at least 2 of these babies inside your kit because there's likely an entrance wound, there's also probably an exit wound. So make sure you have at least 2. That also brings upon the points of decompression needles. Decompression needles can be very useful if you know how to use them to decompress any sort of overbuilding of pressure in the thoracic cavity. However, I do not personally carry them because I am not trained adequately on them. Another one to note is the nasopharyngeal airway, or NPA. These are tubes that are stuck through the nasal cavity that are used to stabilize the airway while a patient is being treated and taken away for further treatment. These come in various different sizes or gauges for each individual's nose, and I personally opt not to carry them for that reason, as well as, again, for the lack of training that I have on them. Again, do no harm. Another absolutely essential item is some sort of emergency trauma dressing. These are dressings that are wrapped around and applied with pressure to any wound directly to help prevent the bleed and stabilize it. These are absolutely essential. You want to get at least maybe 2, like I have here, in different sizes, 1 for limbs, 1 for perhaps an abdomen or a head wound. Make sure that you have enough of these to actually apply pressure accordingly to whatever wounds you anticipate. Another really useful item is Tegaderm film. This is a waterproof but breathable barrier that can be used to apply to any sort of wound, especially any burn, and also to a catheter site. It is clear and allows you to better see what the wound looks like. This is great for monitoring wounds as well as preventing them from getting any sort of infection. It is like a large clear band-aid. It is also really good for securing existing gauze or bandages and covering them up so that they are also water sealed. Another item I like to carry are Steri-strips. These are small bandages that are used to bridge gaps over wounds and help assist with moderate closure of them. They're not a replacement for stitches, but they work in a pinch to help further close up those nasty wounds. I also think that ruled gauze is a really, really good multi-purpose tool in your kit. This can be used to also stuff into wounds if need be, or wrap around them, or further secure other dressings by wrapping as well. I also carry some flat pads of gauze because these are great little patches of gauze to cover the wounds and then be further secured by some other device if need be. Speaking of which, I like to carry some sort of small roll of duct tape or medical tape with me to further secure any sort of dressing that I have either used, applied, or improvised. This is a very, very underrated and useful tool to have in your kit. I also like to carry a small pair of tweezers just in case you need to remove any small, minor objects that are embedded or in the way of you treating your patient. Please bear in mind, if you do have something that is deep in a very bad wound, you do not want to try to remove it, so please keep that in mind. We're also starting to move into the boo-boo territory of our kits. This is not an absolutely critical part of your kit, but I do think that if you can get away with it, please try to pack some basic essentials for minor injuries. That's probably the most likely thing you're going to be treating, whether you're at the range or whatever, those things are going to be the most common things that you're going to wish that you had something for. So please plan accordingly. I really like to carry Neosporin with me, of course. That is what goes in the wound as soon as I clean it to help prevent any sort of infection on a minor wound. Next, we have Band-Aids. These are pretty self-explanatory, great for minor cuts and scrapes. I also like to carry various assorted sizes of safety pins on me. These are great for securing dressings in place if needed. Next up, let's talk about medication. I like to keep some over-the-counter items for discomfort and pain treatments. One thing to note, if you are giving medication to somebody else, no matter what it is and how safe you think it is, you absolutely need to have their consent. They need to be made aware of what you're giving them and what the dosage is, and you absolutely are responsible for verifying that they have tried these medications in the past and not had any issues with them. So first of all, I like to have some ibuprofen on me. This is simply for inflammation and headaches. Keep in mind that ibuprofen is an NSAID. It does slow down clotting, so if you do have somebody who is bleeding, never ever give them ibuprofen or any other NSAID. Next up, for that reason, I do carry acetaminophen. This is not an NSAID. It is safe to give to somebody who is bleeding for pain relief. Lastly, I do like to carry a little bit of Pepto-Bismol just in case your tummy hurts. Pretty self-explanatory. And as we are rounding out the very end of our kit here, there are some very, very important accessories that you may want to include. Primarily, I like to have some sort of emergency blanket. If your patient or yourself has been injured, shock can create a very bad hypothermic situation. Let alone if you were outside in the elements, this is still an absolute essential survival item to have. On the opposite end of the spectrum, we also want to deal with heat casualties. We want to make sure that we are always prepared for people suffering from heat exhaustion, whether that's yourself or somebody else around you. For that reason, I'd like to carry Nuun tablets, which are an electrolytic tablet that you can drop into your water and restore electrolytes. And so, that's my IFAK in a nutshell. My IFAK may look very different from yours, and that's okay. Each IFAK is designed around the user's purposes, needs, and skills. You need to make sure that you're designing it and tailoring it to yourself. Don't use what I'm doing as a complete template for yourself. Just use this as inspiration for whatever you do moving forward. I really appreciate you all tuning in, and until next time, I will see you. Be safe. Take care. Bye.